this is again another quality improvement project. So that's implementation of a 2 monthly gynecology QRS newsletter to improve communication, learning, and patient safety. So the background was that clear, consistent communication is really vital for high quality patient care. So, so the key elements we need to update the people on would be updated guidelines, safety alerts, clinical learning points, and in gynecology, it's very important because we are practicing evidence-based practice. So it's very important to keep the team updated about the new knowledge. So so usually what we so we identify the gaps and with through informal discussions and incident reviews, uh, and we gather where the gaps are, where the staff is unaware about recent protocol changes and missed clinical updates. So so having these gaps um, identified would be important to add it into the newsletter so that we can spread the knowledge across the department. uh, yeah, so the problem with not the team not being updated about the um, updates is that there can be inconsistent adherence to the protocols, like for example ectopic pregnancy can end up having complications that could harm the system as well. uh, so so in the structured regular update of all staff, so aim of this QIP was to achieve that, to enhance departmental communication and promote patient safety. So so 2 monthly gynecology quality risk and safety newsletter started. So the goal was to bridge knowledge gaps and foster a culture of continuous learning. So the baseline assessment, so you conduct a baseline survey to assess the staff awareness of recent safety updates, knowledge of guidelines, and a survey distributed to all gynecological staff. And then we design the newsletter uh, after identifying the area that needs to be discussed further. So design actually should be 2 monthly visual engaging newsletter, including recent incidents and learning points, update to protocols and guidelines, key clinical safety priorities, updates on QI projects, and yeah, and so the distribution we electronically. So we distributed electronically so that we can display can be accessed by all the staff members, and the feedback collected, and then so assess the clarity, relevance, and impact of practice. So the results actually staff reported higher awareness of guidelines and alerts after the newsletter. So it's that's a so it was praised for concise presentation and practical relevance, and feedback was positive, and so there was high engagement. And yeah, so overall, after implementation of this overall awareness in the department uh, and enhanced, so we continue to uh, have the newsletter every 2 months. So conclusion of the QR's newsletter is a sustainable, low cost, and effective method of sharing knowledge and keep the team up to date. And it improves communication, reinforce safety culture, and also like so updates can be given to the team in a shorter format, is to in a way that is to understand. Uh, so our suggestion is that this newsletter to be adopted for by the other departments to uh, like have people of the team um, up to date regarding the things happening in the department. Uh, yeah, so that's it. Thank you. Any questions?